So thank you so much again for joining us today for a GRRAND webinar with Professor Carol Rivas. My name is Mirtoka Koulidou. I'm a postdoctoral researcher based at King's College London and also one of the researchers in GRRAND. A few words about GRRAND. GRRAND stands for Group for Research in Relationships and Neurodiversity. And we aim to deliver participatory, creative research and knowledge exchange to understand the emotional, physical, and mental well-being of people with or without neurodevelopmental conditions and other syndromes across the lifespan. And to do this, we are working hard. We really try to work hard with rather than for the communities in more experience-sensitive and neurodiversity affirmative ways to ensure that really our research attunes to the needs and the priorities of the communities we serve. And it's a great pleasure and a privilege to have Professor Carol Rivas today. Carol's research aims to deliver practical and theoretical understandings of vulnerability and social interaction to support changes in policy and practice. And Carol's focus is on hidden disabilities and intersectionality. And in today's talk, Carol will describe the different qualitative and collaborative participatory methods she has used to facilitate increased understanding of the embodied experiences of disabled people, those with chronic health issues, and people from ethnic minorities. And Carol will also touch on her experiences of doing this research as a neurodivergent researcher. Carol, it's great to have you, and thank you so much for agreeing to be a speaker in this year's GRRAND webinars. The floor over to you.
Thank you very much. So I'll just try and share my screen now. Okay, so yeah, thank you very much for having me. And so I'm going to talk, as you said, about basically breaking down assumptions in research on marginalised people or people who have been decentered. And I think a lot of things I'm going to say now are practices that I'm happy to say that GRRAND already do. So, I'm going to give you the structure of the talk today now. Sorry, I'm moving things. First of all, I'm going to talk a little bit about myself. Then I'm going to talk about my general work focus, how I've developed methods in my work, projects that other researchers might call challenging, but my argument is that they are not at all if you use the right approaches. And I'm going to mention one project where we successfully shifted the power balance from the researchers to the participants. And then I'm going to bring together all the different things I'm talking about to talk about my most recent study, the Cicada study. So I'm going to talk about the approach we used, the methods, and how we disseminated findings. So first of all, me and my family. Well, the photographs on the left are me looking rather sulky as a young child. And I wasn't diagnosed as neurodivergent then, but I think all the photographs show me looking like this. So I'm thinking now that this is because of the experience, the sort of my embodied experience of neurodivergence and how people treated me, but also it might have been because of the racism I experienced. So in the top middle, you can see my father. He's the single figure at the back of the photograph. So he's wearing his traditional costume. He was in a choir. He's Ukrainian. And then my mother was German, and they were both refugees. So I've got that background. And then my children, two of my children have ADHD. One has autism, and one, like me, has ADHD, autism, and Ehlers-Danlos syndrome, which many of you may be aware of. It's often co-occurs in people with autism, and it's where we don't make proper collagen. So it affects a range of things, including mobility. So what this has done really, it's given me chameleon-like properties. So with this diverse background, I can shift my identity depending on who I'm working with and who I'm talking to. So I can be Ukrainian if I want to, I can sound German if I want to, I can sound English if I want to, because that's what I look like. and in the same way with the neurodivergence. And I've actually been fortunate as my career's progressed. People, academics, colleagues and so forth have focused more on what they see as the positives of neurodivergence. And so they're focused on things like my own hyperfocus leading to a lot of outputs, not realising the cost to me of this hyperfocus. But I am motivated to do the work I do. And also I have pushed myself because of this feeling that I'm different. So I've had to prove myself. Perhaps because of the autism, I always try and have concrete outputs. So things that will lead to change, tangible things. And then there's my creativity from the ADHD, which is also seen as a positive because it makes me innovative. And so because of the acceptance at this stage in my career, I've increasingly been able to act as a bridge between other neurodivergent people who are less fortunate than me in the way people treat them, and the powers that be. So I've been able to increasingly fight against discrimination. And so, but most importantly, in terms of my research, I believe that this background gives me the ability to be sensitive to many different worlds and to really understand both the marginalisations that people experience, but also that we're all really different, which is why one of my focuses is on intersectionality. So now I'm going to talk about my work focus, which Mirafor has already kind of summarised. So I'm really interested in people's embodied experiences because of my own background. So in other words, how they feel in their own bodies about their particular identities. So if you've got a disability, it's how you feel about that inside, having autism or ADHD or whatever you have. And then how you externally represent that to people. And of course, we know that often with neurodivergence, people use masking. So it includes things like that. It includes following rules, not responding to microaggressions if you're a marginalised person. I mean, it also includes what happens when people do respond to microaggressions, do break rules, and so forth. And then I look at things like health and social care, institutional ways of managing both people's external representations of their experiences and also how they're feeling inside. So how do services actually understand the true experience that people have, and how do they respond to people who give particular representations of those? And all my work aims to improve the lives and experiences of marginalised people. My son this morning suggested I put up my iris profile to show one of the key features of my work, which is, as I said before, quite creative and innovative. And having ADHD, I get bored quite easily with things. So I'm always seeking new challenges, which means that I've got expertise across a range of different methods. Early in my career, that was seen as a negative, but now it's seen as a positive. So any early career researchers who are listening, you know, if you keep going, if you're like me, and you dip into various different types of approach, it gets easier as you progress up the chain. The main approach that I use, and I'm going to talk today, I'm not going to talk about my quantitative approaches really, but focusing on how to capture the voices of the less heard using participatory approaches. And so there are various things that you have to deal with when you do that. First, the structural barriers such as racism and ableism. Then there are the individual factors. One reason that researchers often don't include the less heard people, so people, neurodivergent people, disabled people, people from minority ethnic groups, is because they have low expectations of what they are going to be able to provide. And then there's another belief that the people who are going to contribute, take part in your research, are only going to be what people label as the most able or the most assimilated, and therefore they're not going to give authentic views. So therefore researchers don't bother at all. And then there's the converse of researchers actually thinking, okay, well, we can tick a box, let's just get those, the low-hanging fruit, the people who are the most assimilated and the most able, and then we've satisfied funders, we've ticked the boxes. And then the third thing is about using the right involvement tools. Researchers, even when they try to involve the less heard, they often don't use the right tools. So you need to tailor your communication, the way that you involve people, according to their particular needs. Then if people don't get involved and they don't respond, they often get blamed for not taking part, rather than researchers actually looking at their own practices. Having said all this, participatory methods have been increasingly popular in recent years to try and get around these different barriers. And there are many different ways that people talk about participation. And I've used this particular diagram because at the centre of the wheel, you can see the various different stages of a research project. And the point of that is that you can involve anyone at any stage of a research project. And you can see that on the right-hand side, there's a list of the different ways that people get involved in research. And so the most basic is information, where you inform other communities about your research. So this is the one-way process, and it's the way that it used to be done routinely, and it's very flawed because you're not hearing the voices of the people whose policy and practice is going to be affected by what you're doing. The second way is consultation, which has been used a great deal. It's a bit better because you ask communities about their needs and preferences, but if you only do consultation, the problem with that is that researchers often then take the results of the consultation and then impose their own views on that. They decide what they're going to take forward, what they think they can do, as they cherry pick different aspects of the consultation outputs. So unless you then go back to your community with prioritisation exercises, that's also not a very good way of doing things. And then another way is to involve people, so actually working with the community that you're doing, and I'm going to talk about that and how I've done that sometimes with people. And true collaborations, working as equals together. And then I'm also going to talk about how I've used that approach. And then empowerment. So empowerment is where the community itself is making the decisions on the research. And it's quite hard to do that in academia. Sometimes people say they do it in academia, but I argue that they probably don't do it, because in academia, you're usually funded. You have, as an academic, you're accountable for the project. So you always maintain some sort of power differential over anyone else. But community groups successfully do it. So the point, of course, of participatory research is that you're working with and for people rather than on them. The people who are affected by your research. And I always include everyone who is affected by the research. So, for instance, in my work, my healthcare work, I won't just involve patients, I will also involve the NHS staff, because all the different sides need to work together to generate ideas and actions for change, because if you don't hear all the different voices, then you're not going to be effective. So if you just talk to patients, for example, and they say, well, we really need this, and then you take that idea to the NHS will say, well, we don't have any money, we can't do it. So you really need to negotiate solutions that satisfy both sides. And so that's what I always do in my research. So using these approaches, what you need to aim for is meaningful participation, not just ticking boxes. Many researchers will just do one of these participatory approaches, and I think you need to explore doing more than one approach to really be effective. You need to have a strength-based approach, not a deficit-based approach of your expectations. As I've already said, there's usually a low level of expectation about what the less heard people can provide. It's important to remove all the different access and accessibility barriers, and I do most of my work is around disabilities, so I need to consider the range of disabilities. So it's not just providing comfort breaks, it will be making sure the materials are accessible for everyone with different types of need. For example, it's making sure that there's good structural support, that the ways that people can take part are varied, not just one method, one approach, but various approaches, giving the right information, making sure people have the right resources at the right time, giving people enough warning about any changes to programs, and being clear about when things are going to happen. And these also cut across cultural needs. For example, with groups, ethnic minority groups who don't speak English as their first language, the same sorts of things become really important. Sorry. And for meaningful participation, you therefore need also to consider the range of intersecting factors, such as whether someone has a disability and is from an ethnic minority group, whether they are from, they have a high level of education or not. Excuse me, I'm really sorry. Their gender and so forth. So all of those different aspects need to be considered for meaningful participation. And I often go further than many people, and I've just been talking with Miraflora about this because I understand that GRRAND is also trying to do this. So within any particular marginalised group, there are always going to be voices that are the least heard of all. So some people are more marginalised than others, even within marginalised groups. So it's really important to get the full range of voices within any marginalised groups. People with intellectual disability, for example, are often not even represented in government policy at all because they don't take part in surveys, they can't fill them in. And so I'm going to talk about how my group has successfully included people with learning intellectual disabilities, for example, sorry. And associated with all of these features, it's important to always recognise that no group is a homogeneous mass. Within any group, one size does not fit all, which I know is quite a strong ethos within the neurodivergence community. And finally here I said that it's important to recognise the expertise of participants as well as talking to them about their experiences, because if you don't do that, you have this phenomenon that I've already mentioned, that the researchers will then take the experience data and then put their own interpretations on things. So it's always important to involve your participants in your interpretation and understanding of the data that they have provided. So I'm now going to talk about how I have developed some of these methods. And I started doing participatory research before it was fashionable to do that in the early 2000s. And so I started because I started collaborating with a designer called Alison Thompson. She just graduated from the Royal College of Arts and she needed an academic mentor. So we worked together. And one of the first projects was looking at the multiple sclerosis patient journey. And the point of this is for their annual review, multiple sclerosis patients will travel from all around the country to the very few centres of expertise there are. And so you get people from Essex travelling for 2 hours, for example, to go to the Royal London Hospital, where we were both working at the time. And so she said, well, we need to think outside the box. If we just ask people, how can we improve your patient journey, they're going to be stuck within the existing patient journey and they're not going to come up with anything very helpful. So she said to them, imagine you're going to Spain, and she gave them these tangible tools, resources, which for me, being autistic, is very helpful. So to help me imagine the journey to go to Spain, there were things like pretend passports, pretend phrase book, etc. And so this got our participants talking about, and they said things like, well, when we get to the hotel on holiday, the first thing we want is a cup of coffee, but we don't know where anything is. So we have to ask the hotel reception. And then developing this idea with them, they said, well, what we'd really like is when we get our appointment letter sent out, we want a map in there which clearly marks where people who have mobility issues because of multiple sclerosis can easily get a cup of coffee. So that was one of the things we did. We also did things like a jargon buster dictionary instead of a phrase book to help them. And then the photograph at the bottom is another project we did together, and this was very transformative. So at the time, pharmaceutical companies were only testing their multiple sclerosis drugs to see if they could slow down a deterioration in mobility, but they weren't looking at hand function. And so we got together a group of people with multiple sclerosis, and it's very hard to see in the photograph, but at the back there's a table and it's got all kinds of things on there that people could play around with their hands and talk to us about the experience. And also some, you can see, pieces of paper with words on so that people could use emotion words if they weren't able to articulate their emotions well. And what we learned from that was that hand function isn't just important to do things like one participant said, to get the yogurt out of the bottom of a yogurt pot, but it was also important for signing legal documents. So if you didn't have hand function and you couldn't sign legal documents, you lost all autonomy, all legal power. And so we fed back these findings to the pharmaceutical companies. And so now they actually do clinical trials on hand function as well. So these methods can be very powerful and transformative. I've included this example of working with artists because this was a project we did where we actually did a resource pack for artists and academics to be able to work together in a true collaborative form. So we tried to write resources that would help researchers empower artists and artists empower researchers to understand their different points of view. And you can see that we were trying out some of our ideas ourselves in the photograph there. Okay, in this next section, I'm going to talk about projects that I don't think are challenging, but many people would do. And so I believe that you can use participatory approaches with anyone. So this is what I've called an AI project that I did. So I was leading on this, and we were developing a dashboard for healthcare staff to be able to look at the free text comments in a National Cancer Patient Experience Survey. And the free text comments, so at the end of a survey, you get a little box saying, have you any other comments? And at the time, machine learning approaches couldn't analyse those because machine learning then depended on grammatical correctness of sentences. And if you've ever filled in one of those boxes, sometimes people put one-word answers or just a list of things that they'd like changed. They're not usually grammatically correct, or they use slang. So we used an advanced machine learning approach that seemed to sort the comments into different themes very well. But then we wanted to validate it. We wanted to check with people with cancer themselves and related to healthcare staff whether these themes resonated with them, whether the machine learning had done a good job. Now, people with cancer, often terminally ill, a standard way of doing this approach would be to do something like a Delphi survey, if you know about those. I don't have time to go into detail, but basically it would be sending out repeat surveys over a few weeks to people. And we felt that was too taxing for these patients. So we decided to have a special one-day workshop and make it fun. And what we did is we gave the participants 100 of the comments from the comment boxes, very representative comments across a range of topics, on a single piece of card, one comment per piece of card. So each participant had 100 pieces of card, and we asked them to sort them into themes and give those themes the name that they thought was appropriate. And the idea was that we were going to go away later and compare that to what the machine learning did. So during lunchtime, my researchers took all the little piles that everyone had done, and they entered each pile separately onto a special computer program that did a statistical analysis of what everyone had done. And the beauty of this was that it produced within the lunch break the little map that you can see at the top right-hand side. And so the point of this map is, for example, if you look at these two little clusters here, they're very close together. This cluster is all on its own. So most people agreed on that theme, that is healthcare staff and patients working together. They all agreed on that, but they disagreed on this theme. And so it turns out that the patients were talking more about finance, and the healthcare staff were talking more about giving the right information out. So comment 26, these are all the numbers refer to different comments. Comment 26, we could say to the group in the workshop, well, some people thought it was in this theme, some people thought it was in the other. Where should we actually put it, or should we have a whole new theme? And through that sort of negotiated approach, we were able to get our final dashboard. This is a project that's being done by one of my PhD students, and I actually recommend that you invite her to give a talk, so I'm not going to say much, except that she was using the mosaic approach to involve autistic pupils who also had intellectual disability and were non-verbal in our research projects. And so what she was looking at is what outcomes people wanted from relationships and sex education. So she was able to find out what these pupils wanted through this restricted mosaic approach. If you don't know what the mosaic approach is, it's basically providing multiple ways for people to choose to give you feedback. So you could, people might choose to do a drawing, do a collage, take you on a walk around the school, for example. So you're inviting them to contribute in whichever way they want. This was a restricted form where she gave them only 3 options. So one option was collage, one option was to move the pictures around on the mat, to say whether they wanted something, were neutral about it, or didn't want to know about that. There's a middle method called the diamond approach, which no one chose. So she was able to involve these pupils, and most people would not even try this. And this is another project. These were children with complex medical care needs. In other words, they rely on feeding tubes or ventilation in order to be able to live at home. And this was a joint project I led on. And so we looked at 5 families in the UK, and in Japan they also looked at 5 families. Some of these photographs are from Japan. And so we gave 5 children a special smartphone app, and it was enabled them to give us a diary understanding of their experiences over 6 weeks. And we sent them prompts. So we would say, we'd send them a text saying, for example, can you tell us about what it's been like to eat food this week, or what socialising has been like this week. And it was a very easy way for them to contribute. Some did videos, some did photographs, some just wrote text. And you can see the girl in the photograph here with the green top. So she normally had a feeding tube. She spent her whole life being ostracised by people because of it. They'd look at her and go, oof, and disabled. And so she said that during the pandemic, it was great because by wearing the mask, it hid the entry point for the feeding tube. So no one realised anymore that she was disabled. And so it was the first time in her life that she felt that she was being treated as if she was an ordinary girl, an ordinary 17-year-old, and she went around and volunteered for the pandemic. So using different approaches, you can really get these very different experiences of people. So I'm now going to talk about one project where we shifted the power balance, and this was undertaken while I was working at Queen Mary in London, and we just had our offices refurbished, and we heard about a Bangladeshi sewing group, and so we commissioned them to sew wall hangings to decorate our new offices. And so we paid them for that, but we did more than that. We said to them, well, we want these wall hangings to be about healthy eating, and how about you come to the university and teach us how you do the sewing, and we'll do the sewing together. And so they did that over a number of weeks. So we all made the wall hangers, researchers, a group of researchers, and this local sewing group. And so they had the power because we were the non-experts, they were the sewing experts, and so they were teaching us during these weeks. And what that did was it changed the conversation entirely. And so they started chatting about their eating habits and healthy foods, and in ways that we would never have, we got an understanding that we'd never have got if we'd interviewed them. And here's another project I want to mention. This is the Healthy Eating and Active Lifestyles for Diabetes in African and Caribbean Communities project. And what's special about this is we used participatory approaches to understand people's experiences of diabetes so that we could develop an education programme that worked for them on how to eat more healthily and take exercise. And our participatory approaches, which is what I led on, won a national award, as you can see on the left-hand side in the photograph. But more than that, what I wanted to say is we actually involved our participants in truly developing some of the outputs. So, for example, some of them actually made exercise videos and starred in the exercise videos that are now being nationally distributed. So all of this is very important. And then we rolled out the programme. And when we rolled it out, we had professional educators doing the main educating, but we also trained people from the community. So each professional educator running an education programme had a member of the community with them, also as an educator. So that lay community educator could make sure that all the education was being done in the appropriate ways for the community. And one of the community educators said, they will still call us the hard to reach group. And I just smiled because I think to myself, we don't bite, we're not hard to reach. You guys turn that around and prove the point. We will give, but we cannot give if we don't know what you want. You came and asked us. Everybody goes to research that's already been done on paper and then make up when they're the hard to reach. We're the easiest people to reach. We're very open. So I put that quote in because it reinforces the point that participatory research is possible for all if you use the right approaches. And so finally, I'd like to bring that together with the Cicada study. It's my most recent project. And this was looking at the pandemic experiences of people from minority ethnic groups who are living with chronic conditions and disability. And the aim was, it was a strength-based approach. We were looking at what had worked for them so that we could inform future policy and practice. We took an intersectional approach. So this was a very big, complex study. I do complex studies. It's something that is sometimes criticised, but I believe that it's important. This is my ADHD, perhaps trying to make sure that as many avenues as possible are covered so that we get a complete picture. So we involved a range of different ethnic groups, as you can see here. We looked at the intersection with having being disabled or having a chronic condition. And here you can see that to make this manageable, we had to categorise disabilities and conditions under just a few groups because we couldn't consider each different condition separately. It would have been an impossible task, certainly for the quantitative researchers to do any statistical analyses. And so we came up with ideas around sort of the impact of conditions rather, whether they affected your mobility, for example. And so neurodivergence is in here as a disability so that I can include it and get funded for it. So there are some questions around these categorisations, and that is what happens with an intersectional approach. In an intersectional approach, you start off by using faulty categories, And using the intersectional approach, you can then break down those categories and critique them. The other really important intersection or factor that we considered was citizenship, because, for example, undocumented migrants don't have access to services. What we also found during the research, we didn't consider it specifically, we didn't foreground it at the start of the project, is that actually socioeconomic status, whether you have a good income, the type of work you do, and your educational level were the most important factors affecting people's experiences. And this quote here just shows the importance of having an intersectional approach. So this is a South Asian lady who was anorexic and also autistic. So she's talking about her anorexia treatment. And she said things like, the treatment I got was very British Western, and I eat with my fingers in my culture. And I wasn't allowed to do that because they said that's an anorexic thing. So that I found quite discriminative because I felt penalised. And there were other things like I wanted a green apple and not a red apple because I felt safe. And they said, that's an anorexic thing. And I said, not, that's my autism. And so you can see, if you don't have this well-rounded understanding, you're not going to give people the right treatment. You're not going to treat them in the right way either. So she felt really marginalised. I wasn't going to show this, but I've accidentally shown this. This is just an example of the 4 categorisations I did. So there's an example of long COVID there as affecting mobility. It just shows the faultiness of categorisations, and you should always critique any categorisations because we all know long COVID doesn't just affect mobility, but in the study we focused on its effects on mobility at first, and then we decided that we needed a more holistic approach. So I'm going to look at the methods we use in a bit more detail now, particularly our participatory approach. And so we use different forms of participatory approach to make sure we really involved all the people that we wanted to involve. And we started off by recruiting researchers from the community to act as researchers alongside us. So we trained them, and they did some of the interviews. We did almost 280 interviews in the end, many with their help. I'm going to talk about all of these different forms of participation in a bit more detail in a second. We then did collaborative workshops, so that's where people that had been interviewed got invited to meet other people who had been interviewed and discuss our findings. We did a sense check on our interpretation of findings, and they also talked about any changes in the 5 months since the interviews, and then we had workshops again 5 months after that to do the same thing. And when we had all this data, we then did some co-design workshops where we designed outputs using our previous findings with mixed stakeholders, so with NHS staff, with social care staff, with community leaders, as well as our original participants. And running through the study, we had a community advisory group and we had charity partners. So our lay co-researchers were equal partners in our research team. We trained them and then they could work independently. It was very successful, but it's just important to note that true co-research is rare. And I know GRAND is currently successfully doing this, but at the time that I started my study, the only published example I could find was of a failed attempt. So this is in academia. In community groups, working alongside people from the community is much easier, but in academia, what you have is a lot of university red tape, and this is what led to this failed attempt by Marks and colleagues. By the time they'd worked through all the red tape, the project had ended, and so all the co-research could do was inform them, act as a consultant and inform them. I think it was actually serendipitous that we were successful, because what we decided to do is recruit our co-researchers from charity groups, community groups, and they put adverts out. They did not act as the gatekeepers. They didn't choose who took part. It's our lay researchers who did so, which is really important, because gatekeepers can really bias who you find. The co-researchers went out, used their networks and went deep into the local communities. But the co-researchers that the charities found for us all happened to be volunteers working for them. And so they'd already undergone some of the red tape, they'd had background checks, etc. So we didn't have to go through the whole process. I don't have time to really talk about the training, but just to mention that it was very important for us that we were sharing expertise. We weren't just telling them what to do. So they modified our study, and bringing them together in training led to team building. They developed a peer support WhatsApp group, and they helped us understand limitations of our sampling. So we had purposive sampling where we wanted to include specific people. And so, for example, the Newcastle co-researcher might say, well, we don't have any, I can't get any East Europeans for you. And the Manchester one might say, oh, well, I can focus on those then. So it was generally very helpful. Sorry. So these are some photographs from our collaborative workshops, which I've mentioned. I just want to say that they were very structured, which for someone like me is quite important, because if I'm just asked, what was it like during the pandemic for you? I'd have to say, well, what do you mean? That's too vague. So this structure, as I said, helps not just neurodivergent people, for example, but also people who are not fluent in English. And we gave them examples from our data, and I have to say that I really curated this myself, because some of my team weren't insiders from these communities, some were, but the ones who weren't sometimes overgeneralized from findings. So, for example, some of the autistic people that we interviewed said, well, it's been great during the pandemic, don't have to meet people when working from home. So they generalized and said, working from home is something that all autistic people should be allowed, should do. And I said, well, no, it doesn't mean that. It means that it might suit some autistic people, but some might get lonely like that. So it's not a blanket recommendation. You need to understand the nuances and hear the different voices of different people. This is a photograph from the co-design workshops where we had different tables. Each table had a mixed group of participants, so NHS staff, community leaders, and our participants. And some of our co-researchers helped us facilitate all these different workshops, so they stayed with us all through the project. So how were the co-design workshops run? So at the start, on the left-hand side, you can see a lot of text. These are the some of the findings from the data about the strategies that worked for people. And my group just put the strategies in a list. I said, well, I don't understand them out of context. So we added context for people who needed the greater context, even though it meant a bit more reading. And so the first thing we did, we said, okay, take some of these ideas and can you do a plasticity model for us? When I did this, I had to do something very concrete, but other people did more abstract things. So it didn't matter whether you had neurodivergence or whether you didn't. Everyone could take part. Different disabilities, people with different levels of hand function could take part. It wasn't important what they modelled. What was important was the talking that they did. Just like I said with the sewing project, it was more about the conversations that were had about the modelling. The second stage of the project, we said, okay, look at those models and then make one or two models as a group. So these were individual models. Now as a group on your table, just make one or two that you think could be really ambitious. If you had all the resources in the world, what would you like to do? And so they did this blue sky thinking. And then in the third stage, we said, okay, how can we make that blue sky projection work now? What do we need to modify to get it accepted by the NHS, for example? And you can see the table there with some of the models displayed, and we had an artist as well drawing conversations. And our community advisory group was key throughout, just in the same way. They worked really in the same way as the co-researchers. And so you can see this community advisory group member is talking about helping to facilitate the workshops and saying the project leaders prepared me and fellow facilitators with sufficient information and knowledge to ensure that we felt confident and competent to carry out the tasks. This meant that I not only contributed to a worthy and important study, but also learnt new skills, met new friends and grew in myself. And there are so many words in there that show the importance of doing good participation. You give people new skills, you give them knowledge, you give them confidence, and you prepare them. So you can take apart this entire phrase and every word is important in it. So finally, just very quickly, dissemination in the project. So our collaboration with our charity partners was really important because they could draw on their understanding of local communities in a way that we couldn't, and they also had a good understanding of how to affect changes in policy and practice. So they produced their own documents that we could use with politicians and the government. So we've actually helped to inform government on disability and employment at the moment with our project. And we've also, the community, the charity partners that we've had, at least 2 of them have actually changed their practice as a result of our work. By working with us, they are developing some of the things they do. The project has given them the evidence that they need. And finally, I said, well, we need to involve everyone in the dissemination, in the knowledge exchange, knowing what our findings have said, and to give them the chance to feedback on what we needed to do going forward. And so I held a theatre show, and this is, I think this is a good example of the ADHD. I said, okay, I have never held a theatre show before. I have no idea at all how to do it, but UCL has a theatre called Bloomsbury Theatre. Let's have a theatre show. It's going to be scripted. It's going to be where we take some of the stories we've heard and we're going to fictionalise them. We're going to do composites that are fictionalised. It's going to reach the emotions of members of the public. It's going to be for members of the public to attend and really get what our participants were saying. And I'm afraid my entire team, I hope they don't mind me saying, said, we're not going to help you on this. This is going to fail. It's going to be really stressful for us. So I did the whole thing on my own. And of course, I managed to pull it off because with ADHD, I think this is the sort of thing that you're motivated to really pull off. And so you can see a clip there. I don't have time to play it, but if you go on the Vimeo link there, and I'm happy for these slides to be distributed as well, you can see a 5-minute clip, and I'm also going to put longer versions on the study website, which is the second link below. And so finally, I just want to say that I think old-fashioned views in sociology say that you shouldn't be an insider. If you have a disability, you shouldn't be doing research on disabled people. And I think everyone here on the webinar today would disagree with that. So the argument was that you'd become too involved, too entangled in what you wanted to happen in the outcomes. You'd want positive things to happen, you'd push in the wrong way. And the same idea was with going native, where people who were outsiders became wrapped up in the worldview of the people they studied. But I hope I've shown today that actually by being an insider, you can bring an extra sensitivity, creativity and understanding of how people need to be involved. And I actually think it has so many benefits. So finally, also just to emphasise that you need to use different participatory methods to serve different functions, and you should draw on a range of methods. And so in Cicada, we used the lay researchers, particularly to reach people that we wouldn't have been able to reach otherwise. And they could also give us local expertise and a better understanding in general. We used the workshops, the collaborative workshops, to get the different participants together to exchange findings and improve our understanding of the different communities. And then we used the futures-based co-design work to develop outputs for impact. And throughout, we focus on practical outcomes. We use an assets-based or a strengths-based approach. We had genuine partnerships. We had genuine collaborations with charities and community groups, which meant that we've already had local impact, even though the study has just finished. and national impact, hopefully. And we had very inclusive dissemination. And I think the last thing is something that is usually forgotten about. And just to say, we didn't get it right. We excluded some groups. More work is needed on all of these things. More work on better understanding of participatory approaches as well. More examples of good participatory work. So thank you very much. And I shall stop sharing, I guess, now. Thank you.
Thank you so much, Cara. This was a fantastic talk. I mean, it was so important to hear you saying how we need to include those voices which are less heard, and how much of a responsibility we have as researchers to do that. And I really liked your point about the methods we use, because in the end, it's all about our research questions and our methods. And I feel that sometimes we hear researchers saying, oh, it's very hard to reach certain communities. So maybe these communities are not necessarily hard to reach. Maybe we've been used to doing things in such conventional ways, and we haven't really learned to move away from these conventional research paradigms and try to use more experience-sensitive ways, try to do things a bit differently. I think, so we have some questions in the chat, and I guess one of the points that I would like to raise is, very often I think there is some skepticism around the use of creative aesthetic practices in research. And I think that I've been in conversations with researchers feeling that there is a dilemma here, that on one hand we have that hard objective science that can give us all the answers that we need, and on the other hand we have work with communities, and somehow we need to choose between these two, that we cannot do both, that either we need to choose work with communities that may bias our findings or may be risky for the validity and reliability of science, and on the other hand we need to choose a more hard scientific way. So yeah, I was wondering what are your thoughts on that, because I find these conversations very fascinating.
Yes, so a couple of points. First of all, I think things like the co-design work that I do, because it leads to actual outputs that can then be tested, is a very useful way of getting acceptance of these approaches. I think you do need something at the end that people can see. I think other participatory approaches, they increase awareness, understanding of people, but it doesn't go very far. But intersectional methods have tended to focus on the more qualitative approaches, and that has been a problem, and there's an increasing movement to encourage more quantitative approaches that can work in parallel. And in the project, the Cicada project, we used both. We did a survey of 5,000 people, and then we synthesized the findings. So we compared the findings of the quantitative methods and the qualitative participatory approaches, and they spoke together. They said the same things. And so I think that's very important, because that helps to validate the participatory methods as well.
It's actually, it's no sacrifice in research. We do way more things. It's like, yeah, it's way more work that still has structure and clear research questions and methods. So there is a question about ethics for research projects that aim to involve more actively and more authentically children. And I know that especially with some ethics teams, yeah, there's not much flexibility. So I was wondering how people can really handle these issues.
I mean, at the IOE, there's a lot of research done on school children, and autistic school children in particular. And I think the ethical processes, they're meant to safeguard children. In some cases, they do the opposite, because they don't allow children to have a voice. And I think there's still a way to go with that. The same with participatory methods. I know national ethics committees are currently talking about both of these issues, because there's an increasing recognition that current ethics actually excludes people. We did have ethical challenges during the project around safeguarding, actually, and yeah, it's very difficult. I don't think I'm answering your question very well, because I don't think there is a very clear answer, and I'm not an expert on doing research on children either. So yeah, so sorry, I can't be very clear on that, but children who are capable of giving informed consent can give it, and just because you're non-verbal doesn't mean you're not capable of giving informed consent. I actually went with a group of researchers to a special school for autists, for non-verbal autistics, and I got consent from the children. Actually, even the teachers couldn't do it, but I think because I have autism as well, I could see the feelings that the children had when people were talking to them, and so I was able to change the way I said things, make very simple sentences, for example. So it's about using the right approaches always, but yeah, you do have to go through the ethics committees, and at the moment they are actively discussing how to change things. So that's all I can say.
Yeah, I'm also working on a research program, and we've been working with adolescents since the very beginning of it. And we've been trying to collect feedback from adolescents of how things could work, from neurodivergent young adults as well, just making sure that we have clear safeguarding procedures, duty of care protocol, clear one. Yeah. So if anyone would like to get in touch about, how we are doing things, and what lessons we've learned, please feel free to be in touch.
Sorry, I do recommend you ask Laura, my student, to give a talk as well, because she can talk. She did have ethical challenges, and she can talk about
that. Would be great. Yeah, that would be wonderful, because sometimes I feel, there's no real transparency around these things, around these practicalities, which are so important. Yeah. And just a few comments like, this has been a fantastic presentation, very empowering, very inspiring. So thank you so much, Carol.